The CDC reports that the U.S. obesity prevalence was 41.9% in March of 2020, and obesity related illnesses include heart disease, stroke, type 2 diabetes, and certain types of cancer. Obesity is a silent and steady killer, but it's killing millions of Americans every year. And GLP-1 receptor agonists, or glucagon like peptide 1 receptor agonists, have emerged as possibly our greatest solution to this issue. I first heard about this drug while conducting my own research for my own personal fat loss goals. And I never administered it, but I was completely blown away by the clinical research and anecdotal evidence backing these products. Now, American obesity is mainly attributed to compulsive overeating, and that compulsive behavior can be related in a lot of ways to something like smoking. So I want you to imagine if you could remove a smoker's actual desire to smoke in the first place. How much power would that have? How many lives could you save with a product like that? And that's exactly the power that these GLP-1 receptor agonists have on people with chronic overeating issues. By the end of this presentation, you will understand just how effective this product is, how it works, and an outlook of its practical applications in the future. So let's start by looking at the clinical research. GLP-1 receptor agonists are well known in the type 2 diabetes community, but this effectiveness is not lost on non-diabetics. In a clinical trial of over 2,000 type 2 diabetics, semaglutide, which is just a form of these agonists I've been talking about, empowered an average weight loss of 33 pounds over a 15-month period. Now, this is astonishing, especially when you compare it to the control group, who only lost 5.5 pounds over this same 15 months. Similar results were also found by endocrinologist Dr. Regina Schaefer when she conducted a study on non-diabetic post-bariatric surgical patients, so people coming out of surgery. They had put on weight and they were helping them combat this. They found that the group that administered these drugs had a weight decrease of 6.7%, speaking in terms of their body fat, over a 6-month period. And the control group who did not use the drug only had a 0.8% body fat decrease. I mean, these results are astounding. So we understand that it's effective, but how do GLP-1 receptor agonists really work? GLP-1 receptor agonists empower a multifaceted attack on the problem of obesity. And this attack begins in the stomach, where they slow a process called gastric emptying. And gastric emptying is basically just how fast the nutrients go from your stomach to your lower intestine. And at the same time it's slowing this gastric emptying, it's also secreting more insulin from the pancreas. This insulin response is similar to if you would have a big carb meal, you would kind of get the same sort of insulin secretion. So the combination of these two aspects sort of tricks your brain's pituitary gland into signaling to the body that you're just not hungry. And this effect is so powerful that one patient reports, "It felt effortless losing weight while on trial, but now it has gone back to a constant battle with food." So we understand how they work and that they work, but is this practical for the future? Can we use this? The future and the practical use of these drugs is very bright. Online bodybuilding and lifestyle coach Vigorous Steve reports, "This is the best appetite suppressant I've ever used." And on his website, there are thousands of clients who have used this product, giving anecdotal reviews, and they're overwhelmingly positive. He also explains that there are many other products aimed at this satiating effect and aiding in fat loss, but that this one is so much more effective with such a lower side effect profile that it is head and shoulders above the rest. And speaking on side effects, in a comparative review, Dr. Claudia found that the side effects were as followed. There are gastrointestinal side effects of nausea, vomiting, and diarrhea being common following initiation, but that often subsided after time. Now, this brief side effect profile makes this drug an excellent candidate for practical use in the future. So I'm about to have to leave you, but I'll leave you with just a few more words. GLP-1 receptor agonist might well be our most powerful tool for combating the issue of obesity that is so prevalent in our country today. Now that you understand how effective they are, how they go about treating the root causes of these practical issues, I hope that you are as excited about the positive impact that they can have as I am. However, excitement is not going to help anyone. I urge you to take this information, pass it on to your friends and your family who are dealing with obesity. This might be a tough conversation to have with someone you love, but it's well worth it if you put them on the right track to a healthier and longer life. Thank you.